Dr. R. Kishore Kumar, sir. It's a pleasure to have you with us today.
Thank you. Thank you.
I am Pooja Shah, the Operations Editor for Insights Care India.
Sure.
Yes. So, as the founder, chairman, and director of Cloudnine Group of Hospitals and a leading neonatologist, you have made incredible strides in transforming maternal and neonatal healthcare. So, could you please begin by sharing a bit about your journey in the medical field and also what inspired you to specialize in pediatrics and neonatology?
Oh, that's a good question, but it's a long answer for that. I qualified as a pediatrician in 1989 in India, and I was
Okay.
always interested in saving babies from birth rather than being statistics. And after my MD, I worked for a year in Mysore in Mission
Mhm.
Hospital, and we had saved a baby who was barely weighing 780 grams. And
Mm.
that baby was the smallest at that time. So it became a national headline saying 780 grams was baby was saved in Mission Hospital by Dr. Kishore and all that. So we were excited, but at the same time, I think I was not confident at that time whether the baby survived on its own or whether it was due to my efforts. So I definitely wanted to subspecialize in neonatology, which was not there in India because I had qualified as a pediatrician, but neonatology is a sub branch of medicine which had started only then. So I went to UK to subspecialize in neonatology, where I retrained myself for 4 years. From there, I went to Australia. And Australia in 1993-94, they were already saving babies 24 weeks, 25 weeks, 28 weeks. And that was their specialty. So I further trained in Australia in 94-95 in Monash Medical Center and Royal Children's Hospital in Melbourne, where I specialized in saving the babies less than 28 weeks. And subsequently, I worked in Australia for next 14 years, and also I worked for a year in US. And and throughout this, we used to talk about our success stories. And my parents always kept on saying there's no point in doing service to those countries where they're already there, but you need to come and do something. So what inspired me was the statistics in India was still very, very pathetic because in 2006, when we started Cloud9, out of every 100,000 deliveries, 97 mothers used to die, which is called maternal mortality rate, which is very, very high. And babies less than 28 weeks were still not being saved here, though we were saving in the West for 15 years by then. So we started Cloud9 with the vision of offering to save premature babies and also reducing the maternal mortality. That was our dream, and to improve the standard of maternal and neonatal care. I think we have achieved more than that. In the last 16 years now, we have had more than 250,000 deliveries. And first 10 years, we had 0% maternal mortality. But in the last 17 years, we have had 37 branches across 13 cities in India, and we have lost only 4 mothers out of 100,000 deliveries, which is amazing maternal mortality, lowest rate in the world compared to even Western countries. And
Wow.
and we also save a lot of babies less than 28 weeks, and our chances of survival for the babies is better than many European countries. We can confidently say that because we are part of Vermont Oxford Network as a hospital chain. We are the only chain of hospitals in Asia who are part of Vermont Oxford Network. This is a network who maintain the database of all the outcomes in the Western countries, mainly European, US, Canada, Australia, New Zealand, and compare the outcomes with each other to see who is better. So we have been part of this by voluntary choice because it costs a lot of money. And the good thing is we have been able to compare our statistics, which is better than many European countries.
That's very inspiring. Thank you for answering that. So,
Yeah.
when you have shared this journey, I specifically wanted to know what was the main motivation for you to establish Cloud9 group of hospitals. And how did you envision it for transforming maternal and neonatal care in India specifically?
As I mentioned briefly, the motivation was we used to see too many maternal deaths in
Mm-hmm.
childbirth, and our motivation was pregnancy is a wellness. None of the mothers become pregnant who are sick. If you think logically, a well woman becomes pregnant because they want to have a family, and there is no reason why a mother should die in childbirth. And out of 17 years, I probably don't remember having seen maternal deaths at all in the West. So I wanted to improve the maternal neonatal care and also help save the premature babies. That's why we envisioned establishing just a mother and baby hospital to improve the maternal and neonatal care in India. And that's how we planned to start. And we started the first one in Jayanagar, Bangalore, which is our flagship center.
Okay.
And soon we became so popular because of the quality care we were providing. Then we got private equity, and then we started spreading to offer the similar care across India. And that's how we grown. And within 3 years of us establishing, because of our statistics and our outcomes were so good, we became a case study of success in Indian Institute of Management, Bangalore, and we also become a case study of success in Cleveland University, Ohio, in USA.
Okay, that's very nice to know. So
Mhm.
I'm sure while going through this journey, you must have your own set of initial challenges. So if you could just elaborate a little on those challenges and how were you able to overcome them?
The challenges to establish a mother and baby was hospital was quite a few. Number one being the financial, because at that time in 2006 we needed about 20 crores rupees to establish one good unit, according to estimation. And with all my savings, with all my expertise, I could muster only 3 crores. So we had to look for angel investors to come on board and take the loan and start off the unit. So financially, we could go overcome by getting angel investors, family, and friends to contribute. But the other problem what we had is what we realized was the standard of care, whether it's a nursing or medical care, was not very optimal, and most nurses could be easily trained to the level what we wanted, but that took
Mhm.
almost 3 months on-site training that could be achieved again. But training the obstetricians to the thinking level was much more harder than I thought it was. Because what used to happen is every doctor in India thinks they're the best in the world, and
Right.
there is no way of correcting them unless it comes from interior. So what we had to do was we had to have a weekly meeting. We had to discuss the outcomes. If things went very well, we had meetings to congratulate the team. If things didn't go very well, we had a meeting with no finger pointing to see how we can do better next time. But that was not received very well in the first few months because people felt they're being targeted. So
Yeah.
getting the doctors to sort of come on board and look, at the end of the day, it's not about finger pointing, it's outcome for the particular patient who or the woman whom we are talking about. So
Right.
that also took almost 9 months of our persistent efforts. The fourth thing is we wanted to provide international level of care. Now, if you
Mhm.
look at the statistics in 2006 when we started Cloudnine, 25% of women used to suffer from pelvic floor damages due to childbirth. This was unpublished data which was available on various platforms, and which means that if a woman delivers childbirth and she has a normal delivery or whatever delivery, her pelvic floor damages gets damaged, and then she suffers silently because no woman wants to complain about incontinence of urine or incontinence of motions or problems at the floor of the pelvis because they've silently suffered. The
Right.
second thing is a lot of women suffered from not breastfeeding. Even if you look at the NFHS 5 data in India, only 45 to 55% of mothers breastfeed successfully.
Yeah.
And the reason is not because they don't know breastfeeding is important. When a woman has a problem with the breastfeeding, they don't seek help because they think it's their problem and
Okay.
it's their failure, and they suffer silently. So
Yes.
what we did from day one is we had physiotherapists and lactation consultant available on day one, both antenatally educate the women about pregnancy, childbirth, and what are the risks, what they go through, and talk to them, prepare them mentally. Then during childbirth, we looked after them. Then postnatally, we offered physiotherapy and lactation consultant consistently, and that made a huge difference.
True.
Extent now that in last 17 years in Cloudnine, we have not had any mother with their pelvic floor damages at all. And most of the Cloud9s, we have achieved more than 95% breastfeeding success. But it didn't come through easily because what happened is when we started, the traditional belief among the insurance agencies was, oh, why do you need physiotherapy and why do you need a lactation consultant? You remove that and give us a package. Even the parents who used to come, they used to say, can we have a package without those? They felt it was extra, services which are
Yeah, they
being.
feel it as an extra expenditure.
Exactly. So initially it was very difficult for us to convince them the benefits of those, but fortunately we managed to convince insurance agencies, parents, and now we have 17 years of data to show them that
Right.
this the benefit like this. The third thing was whether it's a normal delivery or a C-section.
Mhm.
Traditionally, women used to spend 3 to 5 days in the hospital.
Right.
Now,
Now they don't.
3 to 5 days is shown that post surgery, the more you lie in the bed, the more complications arise. So
Oh,
there is enough data to suggest that early mobilization helps women to prevent problems. So from day one, we started mobilizing the women, whether they deliver by normal delivery or C-section. Within 4 hours, we used to make them walk. And that early mobility made them fitter, recover faster, and we used to discharge them by 48 hours. And now looking back 17 years, that's the best thing we have done and contributed to India and the world. Early
right.
mobilization helps prevent problems and complications. So all these changes took a lot of time, be it nursing, be it medical, be it financial and insurance. They are one sort of a problem. The other problem is, infrastructure. People were used to sort of infrastructure which it had its own standards. We were the first one to make sure that we have a motorized bed in the outpatients because when you become pregnant, your belly is so big, you lose the
Yes.
balance of gravity, and people were expecting pregnant mothers to climb up the bed, and sometimes they miss the bed. So what we did is we made the comfort so easily. They come and sit on the bed, and the doctor adjusts the bed height
Right.
according to their comfort. So they don't have to struggle. So starting from that to even the rooms, every hospital,
Mhm.
if you go, the toilet is either 6 inches above or 6 inches below the floor. And
Okay.
when a woman has delivered or had a epidural anesthesia, lifting the feet 6 inches is very difficult. So we had to use technology to make sure that the floor of the toilet in the room is same level as the room so that they don't have to struggle getting to the toilet or getting into the washroom without any difficulty. So those sort of small things, infrastructure was taken into consideration in a big way. And third thing is because pregnancy is wellness, we didn't want it to look like a hospital, feel like a hospital.
Mm.
So we made it look like a, you know, hotel sort of a lobby and things like that, and not smell like a hospital. And that
Right.
huge change involved a lot of infrastructural adjustment and talking to architects and talking to engineers and get things done. So all these challenges were there initially, but we overcame in a big way.
That's very nice to know that how these minute details makes a huge difference in patient's life. Like
Yeah.
you call it as a wellness. Yes. So moving on to my next question, how has Cloud9 integrated innovative practices in pediatric care? And what are the advancements you are specifically most proud of?
That's a very, very good question because see, newborn screening is one of the advancements which we introduced from day one. Newborn screening is a blood test which we do on second day of birth of any baby. And this is
Mhm.
not something new. It's been there in the world for the last 50 years. And unfortunately, in India is one of the very few countries where they don't do it. Now, what it does is you take a 2 to 3 drops of blood from the baby
Mhm.
and test the baby for quite a few disorders, which we call it as a enzymatic disorders or metabolic disorders, or disorders which the baby can't digest carbohydrates, proteins, or fats, which can be detrimental to the baby's health. In other words, for example, if a baby has an underactive thyroid, we call it as a hypothyroidism. If the baby is not tested and diagnosed hypothyroidism within a week of birth, the baby will be definitely mentally retarded because thyroxine is required. In India,
Okay.
currently, National Neonatology Forum estimates we have 10,000 babies born with the hypothyroidism every year. Now, that is preventable with 1 drop of blood
Okay.
tested at birth. Now, we are the only hospital started that 17 years ago as a mandatory test. And we have been doing that mandatory test for the last 17 years. And we have prevented almost 500 babies from becoming mentally retarded. Almost 200 babies we have saved who would have otherwise been dead within 3 days of birth due to metabolic disorders. And that is something innovative which we have achieved. Initially, when we started newborn screening, there was a lot of opposition, including some pediatricians in Bangalore used to say, or in India, we don't have these diseases. They're doing it just to get more money from you. So we had a lot of parents getting opposition, but fortunately, with the education, pamphlets, leaflets, which we produced for information, and thanks to Google, parents could check that information what we are providing is correct. We have persisted, and now we have prevented all the problems with so many deserving families.
Right. It feels so good to take your interview today. I cannot express that in words. Yes. So moving on to my next question. Like from your previous answers, we can clearly see how patient-centric approach you have. So especially in hospital, how do you think that influences the patients? These approaches that you're making, these changes that you're moving on with.
Initially, there was a lot of interest. So when
Mm-hmm.
we started Cloud9, we used to talk about these innovative measures. So the press was interested, public was interested. We had a lot of press coverage. We used to talk about it. So that's why, though we were nothing when we started, within 3 years we became a brand. Cloud9 became almost synonymous with the quality care. But
Mm-hmm.
subsequently, what happened is a lot of copycats started copying our things, what we did, without knowing the basis or rationale and things like that. So it got diluted, and now people think that mother and baby hospital is done for purely for monetary reasons and luxury. So it's been turned into a different industry. But what we started was basically out of passion to improve the maternal and neonatal care and scientifically proven, scientific basis. And so that information, a lot of media is now not interested. They want to cover saying that 5-star treatment for mothers. Now, one of the
Mm-hmm.
reasons why we did 5-star is most women will have children once or twice in lifetime now, compared to our grandparents and our parents who would have had 7 or 10 children. 3 would have died, 2 would have barely survived, and those sort of things. So, what we
Yes.
felt is if a mother is having one child, they should not go untreated. So, that's why we make it a celebratory event. And that's why we make it a good experience for them so that they enjoy the experience because it's a once in a lifetime they're going to have a baby. But that's only part of what we do. But media seems to be projecting only that, forgetting the scientific basis behind the quality care. So nobody talks about prevention of, morbidity like pelvic floor damages, breastfeeding problems, all that. If they can educate the public in that, we will definitely achieve more, in
Mhm.
a sense, together.
Right. Thank you for answering that. So, moving on to my next question. What do you think in what ways technology has enhanced the services, especially that has been offered at Cloudnine hospitals? And if you could just keep the more focus on neonatal care for this.
Oh, that's a very, very good question. See, when we started Cloud9 in 2006, I'm going back to the year again and again.
Mm-hmm.
Um, World had already started implementing newborn hearing screening. The reason
Right.
being, if a child is born deaf, they would have become deaf and dumb. And the word dumbness was removed from the word dictionary 2006 because deafness was picked up with the technology of newborn hearing screening from 2004 onwards. So we were one of the first hospitals in India to offer newborn hearing screening from day one. Unfortunately, what happened at that time, there was no equipments being sold in India for newborn hearing screening. So we procured our equipment from Australia. So we started doing the test from day one for all the babies. And it was an expensive instrument because it was 5 lakhs for a small instrument which can test hearing for the babies. And every 6 months, we had to send the equipment back to Australia for calibration to make sure that we are calibrating properly and diagnosing properly. So that was an expensive, you know, um, exercise from our side, but we did it because we believed that we babies should be picked up with a hearing problem soon after birth, because we call it as a rule of thumb 1, 2, 3. That means the baby should be picked up with the deafness before 1 month. Baby should be identified deafness due to birth defect or problems within 2 months, and ideally should be treated within 6 months. 6 months. If you miss those guidelines, then baby will become dumb, and then hearing corrected at a later age requires a lot more efforts to get the speech back into the child, because otherwise baby doesn't hear in the first 6 months. So or first 3 years, whenever you miss the diagnosis, and then the child will never be normal. And you must have seen a lot of people who are deaf even now lip syncing and learning. And that's not a problem nowadays because we pick up the deafness at birth, fix it, and then they're normal. So, fortunately, in 17 years, we have had more than 12 babies who were picked up
Mhm.
as babies with the deafness, treated, and they're all normal. In fact, one of the girls is 12 years now, and she's a professional singer. So, you
Oh,
can imagine the outcomes
right.
we have achieved.
Yes. Great. That's good to know. So, moving ahead, we've seen the mentoring. We'll go ahead with the mentoring stage now. So, as a mentor, how do you contribute to training the next generation of healthcare professionals in pediatrics?
Oh, this is a very, very good question. Not only pediatrics, we mentor we are entrepreneurs, we have health entrepreneurs, we have mentored nursing leaders, and we have trained lactation consultants. Initially, we didn't have any lactation consultants, so we had to train one lactation
Right.
consultant, get her trained by IBCLC in Australia. Now we have 49 lactation consultants across 37 units across India. So not only that, pediatric training we definitely do. We have established neonatal fellowship training. So neonatal fellowship we train under three umbrellas. One is Rajiv Gandhi University, one is IAP, which is Indian Academy of Pediatrics. The third one is Neonatology Forum of India. And under all these aspects, we train the young pediatricians to become qualified quality neonatologists, and we have mentored. And we have mentored more than uh, 200 neonatologists across the country now. And we even sent 46 pediatricians to England and Australia without exams for further training in neonatology after they worked with us.
Mhm. That's nice. I am so amazed how we are talking in numbers. Right.
Yes.
Moving ahead, I'm sure you must have had a lot of recognitions considering your journey, but which recognition has had the most significant impact on your work throughout your career?
That's a very good question. I would like to say this recognition or that recognition, but to be honest, touching my heart, if you ask me which is the best recognition came from my dad, because
Okay.
when we became very popular as Cloud9, my dad
Mhm.
was telling one day, he told me, look, all these days, I used to tell my son is working in Australia and is a big doctor. And people used to say, my son, my daughter is working in US, UK. And I had no argument, I had to listen. But now, the moment I tell I'm the father of Dr. Kishore who has started Cloud9, people's eyes open up and say, wow. So that's the biggest reward or award I can say, probably.
Right. Yes. Great. So, considering the future plans, what are your plans for expanding Cloud9 services across India? And how are you prioritizing the new locations for new facilities?
Yeah, this is a very good question, because when we were 4 years old, GE Capital came to us with a blank check and said, typical GE
Yes.
attitude. They said, "You are so popular. Why don't you multiply it to 100? This is the check. You can take whatever money you want and multiply." I said that doesn't work that way in the health industry. It's not like aeronautical industry, 9 to 5 or 9 to 8. Health industry is different. So I still say the same thing. And the health industry, because it's a 24/7 quality care being provided and hospitality being provided across the 24 hours, not just 9 to 5. And that involves a lot of training. And health industry, unlike other industries, needs a lot of empathy. And staff, starting from security to nursing staff to housekeeping, doctors, everybody should be empathetic, and that takes time. And that's why we have been multiplying slowly, though we had offers from quite a lot of overseas countries, including Bahrain, Sri Lanka, Nepal, and Oman, UAE, Dubai. We intentionally felt we should focus on India because India has large um, maternal and neonatal care improvement required. If you look at yesterday's paper, for example, there were two women who died post-cesarean section in Bellary in a district hospital. That should not be happening. I mean, we are a country, we are talking about nuclear power, becoming a developed country, third economy, largest economy, and 27-year-old mothers, two of them have died in post-cesarean section in Bellary yesterday. So these are the things we want to avoid and save mothers from becoming statistics. So we feel there's enough work, and that's why we are expanding. Currently, we are in 37 branches across
Mhm.
13 cities. But India is a huge country. It's like Europe being a single country. So we are still expanding, and next 2 years we should be opening more branches to become 50 branches. And
Okay.
as of last year, the largest mother and baby chain of hospitals was in China with 28 branches. We believe we have taken over that brand by becoming the largest maternal and neonatal chain hospitals in the world. So now that we have made a significant impact in the private sector, we would like to offer our expertise, experience to make a difference in the public sector too. So there are lots of things which we have on our plate which we want to achieve, and hopefully we should be able to do that in the next few years.
Right. So, since you shared that example, my next question would be, how does Cloud9 engage with local communities to promote maternal and child health awareness?
We have been trying quite a lot, in the sense we did antenatal classes for rural pregnant women quite a few
Mhm.
times in the last few years. We have
Okay.
trained quite a few nurses as lactation consultants in the government sector who have made a huge impact in improving breastfeeding rates in the government hospitals. We are adopting a lot of NICUs in the tier 2 and tier 1 cities and providing them proper care with through tele-NICU facilities. And we have definitely been involving local pediatricians in tier 1 and tier 2 cities who have not had experience in technology and up-to-date neonatal care by being trained by having them come over for training for a day and making them aware of how the maternal and neonatal care has made a huge progress in the last 20 or 30 years. So in many ways, we are doing that both at the district level, taluk level, and nursing level, and also mothers level, and also at the doctor level.
Right. That's nice to know. So, if you have to give some advice to the young medical professionals who are aspiring to specialize in pediatrics or neonatology, or maybe both, so what advice will you be able to transfer to them?
See, pediatrics and neonatology is not a very financially rewarding subject, and a lot of people compare the money, and the highest rewarding subject financially is probably neurosurgery or cardiology. That's why people clamor around that. But pediatrics is one subject where you get a lot of satisfaction. When you treat a child, the child smiles you back and thanks you, and definitely saving a baby, the whole family is grateful to you. In that way, it's very, very rewarding emotionally. And this is not suitable for people who think, thank God it's Friday, because this
It
is
is
a
Friday.
yeah, this is 24 bar 7. Unless you're committed
Yes.
and you relax whenever you get time, this is not for you.
Yes. That's a good piece of advice because when people are working to take care of others, I guess it's a 24/7 job.
Correct, correct.
Yes. So moving ahead to my next question, I guess I just have a three, four set of questions. If it is okay with you, we can continue because I've set in meeting. Yeah,
Yeah, yeah.
okay, all right. Thank you. So moving ahead, like we said, it is a 24/7 job. So how do you manage your work-life balance, especially given the demanding nature of your profession?
The best way to describe is my wife's compliments. See, I don't grumble when it's work. I work whenever I'm free. And whenever a family needs me, I'm always there. So I don't sacrifice family life. But at the same time, when I'm busy, family understands. And whether it's a Sunday or evening or morning, I am in a mood to write papers, research papers, or work on a subject. I do it. And because what happens is when you say, I want to do this on a Friday morning, you may not be in a mood to do it. You may Friday morning, you may feel like chilling sometimes. So you will be guided by your body and mind rather than saying, well, 5 o'clock ho gaya, let me chill and relax and watch TV. I don't belong to that. I work whenever I want to work, where I will chill whenever I want to chill, and I get the jobs done. So I don't grumble saying that this is pending, that is pending. So in that way, I enjoy what I do. As long as you enjoy what you do, I don't think it's a bother.
Right. Yes. So, recently the pandemic has affected a lot of things. So in Cloud9 group, how did this happen? Like, how did COVID-19 pandemic affect operations there? And what were the measures that were taken to, maintain the patient-centric approach and their safety during that time?
That's a very, very good question, but it's a long answer if you want me to tell you, because what happened is in Cloud9, if you look at the demography of the nursing staff, most of the nursing staff come from interstate. So for
Yes.
example, in Cloud9, majority of the nurses, like everywhere else in the world, is majority is Kerala, and we have a lot of nurses from Jharkhand, Uttarakhand, and some from east part of India. So a lot of these nurses were frightened and they wanted to go back because it was pandemic. So what we
Yes.
did is we promised them that we will take care of them medically if any of them fall sick, and it's better that they stay here rather than going back home, because going back home they may not have facilities to get treated. So most of them, with our reassurance, stayed back and worked. In that way, the motivation was higher because we had promised it to look after. Financially, as a hospital chain, we had to incur a lot of expenses because a lot of people became COVID positive, and we had to treat them with the medications and hospital bills paid. But the rewarding experience was most of these people whom we treated, including nurses and doctors, they became very loyal to the extent that the attrition rate in nursing is usually about 30% in the industry. Our attrition rate is less than 6%, which shows that we have taken care of them well. The second thing is because parents and patients never came to hospital because of the fear, we started a lot of remote services like home vaccination, teleconsultations, and then consultations via video. And we also started phone triage system where the nurses used to be available 24/7. Experienced nurses receive the calls from distressed parents, offer services which they can't handle. Then they used to transfer to the doctors to medically handle. So we used a lot of the nurses in a different way because the crowd was less. Be it
Mhm.
home vaccination, be it home consultation, video consultation. So that way, the services were continued, and because the services were continued, the motivation was there for everybody to work because they could interact, they were not isolated, they had
Right.
communication, those sort of things. And in fact, we fortunately, touch wood, we didn't lose any doctor or any nurse with the COVID. Everybody was treated. Some of them were in intensive care for a week or 10 days, but they all recovered.
Right. That's very great. So, lastly, in your opinion, what are the emerging trends in pediatric healthcare that practitioners should be aware of in these times?
Emerging trends can be many things. Technology
Mm-hmm.
is one thing. Technology is something which is everybody should know because I mentioned to you about newborn screening, which a lot of pediatricians may not be aware. But now the newborn screening is progressing to genomic screening, which means that you take one drop of blood, test the genomes or the genes for many deadly diseases rather than doing a screening. This is a diagnostic test. And in
Right.
that way, you can actually identify any genetic diseases which is present at birth. Right
Mm-hmm.
now, it's not commercially used too much because of the cost, but that is going to come down sooner or later, and it's going to become a routine test in the near future. The second thing is, as I mentioned, newborn screening, like medical, whether it's a blood test or a hearing screening, needs to become routine in India.
Mm-hmm.
And the third thing is artificial intelligence. That is thing everybody is talking about, and we have invested quite heavily in Cloudnine. There are two successful stories which I would like to share on artificial intelligence. We have trialed for last 3 years as a pilot project artificial intelligence in neonatal intensive care. And when a baby is born, we don't know whether the baby becomes septic or not until we get a blood culture, which takes 72 hours. With
Mm-hmm.
artificial intelligence, now we can identify babies who become septic within 12 hours. The
Oh,
second artificial intelligence, what we have been piloting in Cloud9, is any mother who walks into Cloud9, we have an electronic database. So we have incorporated artificial intelligence into it. So the data, what we enter in the computer, can predict a mother whether she is going to have a premature labor or not to
oh,
the extent of 80%. A doctor can estimate premature risk delivery for a pregnant lady only to the extent of 20%. So as I said, this is a pilot project which we are doing, but sooner or later this will become available to everybody, and we are going to revolutionize mother and baby care in a big way in Cloud9 because we have always been doing quite a lot of research to improve the standard of care what we offer.
that's very revolutionary to understand.
Right.
So, moving on to my last question for you. What personal philosophy guides your work in healthcare, and how are you hoping to influence future generations through your contributions?
Sorry, I didn't I got what you mean, but what exactly is your question? Personal
So,
philosophy.
what is your personal philosophy that you follow? What is your personal motto that guides you to work every day? And how are you going to influence it for the future generations?
I grew up in a small town called Kollegal, which is about 100 kilometers from Bangalore. And
Mhm.
we had a good childhood, and my parents and my grandparents always taught service to humanity is more important. And subsequently, when I came to Bangalore, I stayed and studied for 2 years in Ramakrishna Vidyarthi Mandiram. So I have been guided by principles of Swami Vivekananda, which and also the Bhagavad Gita. Basically, it says, do your job, don't expect any returns, and rewards will come by itself. So that's my
Yeah.
personal philosophy. So I work, do my job silently. Whether rewards come or not, it doesn't faze me or bother me. But rewards come, it's a recognition for the service we are doing. And it probably, the rewards, what we get, actually helps to others to know what we are doing rather than reward for myself. I feel that this is a reward which, as my professor Nirmala Kesri from Davangere used to tell, rewards are required not because you deserve it, but people should know what you're doing and how good you are at the job. And that's the way I look at it.
Right. So, thank you for answering all my questions. But before concluding this, I would like to know if we have missed on anything, you can just let us know any additional details that you want to convey.
No, your questions were excellent. Virtually, you covered. I must say, I've given so many interviews, but you are probably one of the best to have drafted all these questions and get the answers out of me. The questions which Shruti had sent, that's why I told her that that doesn't give the full impact of what
Right.
you are doing. That's why I said we need the video interviews because then we can discuss more.
I'm so glad to know that. Definitely, moving on, the further process, I guess Shruti will update you regarding everything, the draft and all. And if there's anything you want to convey, if you remember it later on, you can always send her the message or text so that will update it in the draft
Okay.
and she'll
Thank
update
you
you
very
further. Thank you so
Thank
much. Thank you. It was really nice talking to you, and I'm very glad that you liked all the questions and I was able to interview you today on behalf
thank
of
you.
Insight Care India. Thank you so much.
Thank you. Thank
Yes, thank you. Namaste.
you. Namaste.